Please, let's take our seats. Your Excellency Ambassador Meg Whitman, Deputy Governors present here, my CS Susanna Humicha and your team, the great heroes that we celebrate today, dear Kenyans, good morning. Or is it afternoon? Good afternoon. Jambo. Asanteni sana. There are many instances in the history of Kenya's bilateral and multilateral engagements where partnerships have achieved tremendous positive change in the form of policies, programs, and projects. On the other hand, there have been fewer instances where such partnerships have translated into direct, personal, feasible transformation in the lives and well-being of people in terms of ending suffering, reducing the number of deaths, and prolonging the lives of millions of people who might otherwise have faced high risk of agonizing early death. Kenya's partnership with the United States of America through the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, is one of these very rare partnerships. Indeed, it is amazing what PEPFAR has been able to achieve. In fact, as I sat here and listened to what PEPFAR has done, and when I went through the numbers and the notes and what has happened over the last 20 years, and looking at what the decision of one person somewhere very far from us has changed the course of history and made a deadly pandemic into a celebration today. That today we are celebrating a great partnership. If HIV was what it was, this would not be a celebration. This would be something else. Until about 20 years ago, HIV/AIDS went through and ravaged the households and communities of this nation in a deadly rampage that left behind many people dead, others suffering agonizing illness, thousands of orphaned children, with many also infected with HIV, and vast socio-economic devastation. In fact, as I listened to Edna, as I walked in here, I mean, she represents something short of a miracle. The intolerable stigma that haunted infected and affected persons and their families was a huge barrier to access in terms of essential medical and social services, from public, private, as well as within even our societies. Those affected confronted their troubles by themselves, abandoned, neglected, or sometimes wholly forgotten. This country lost millions of people in this manner. And for a while, it looked like the HIV/AIDS problem would wipe out much of our productive population.